Good afternoon, everybody. Thanks for joining us today on our um, live demo about boosting your ASC's profitability with an EMR. My name's Brian Gaffney. I'm a senior director of sales at HST, and joining me today is Chris Pompilio, who's a longtime HST veteran and is going to be going through a live demo with you all here in just a little bit. So thanks for giving us up some time on a Friday afternoon at the end of a quarter um, to spend a little time with your friends from HST. Uh, Walking through just the agenda today. I'm going to go through just a couple of slides on the impact of proactive operations and really what we're seeing in the ASC space, um, uh, mostly centered around centers that are adopting digital charting and EMRs. And then we're going to spend just a couple of times talking through some of the key time-saving features that are tied to the financial success of ASCs. And then I'm going to turn it over to Chris, who's going to share his screen in a live environment and show a high-level demo of what HST's e-charting system looks like. And then we'll also have some time for some Q&A, hopefully at the end here. So thanks everybody for joining us. So a couple of just quick things. We are recording this webinar, and we will be sending it out to everybody that registered to attend tomorrow. And so if you've got maybe colleagues that wanted to join that weren't able to, you'll be able to share that with them. We'd like this to be as interactive as possible. So if you have questions, please just enter them in the chat. While Chris is doing the demo, I'll monitor that chat and we'll interrupt him when appropriate and um, ask your questions. So if anybody has one, just go up to the for me, I think maybe just because I'm displaying it's on the top. For some of you, it might be on the left side. Just hit that chat function and pop a question in there. Perfect. So we will get started. I want to talk just a little bit about the impact of proactive operations in ASCs. As we all know, the world has changed for ASCs. The landscape today is very different than it was, say, 5 years ago or even pre-pandemic, where there was kind of a sense of if you build it, they will come. Since then, we've seen a whole different landscape forced by a number of functions. One of the biggest ones is stagnating reimbursements and a great uptick in competition for cases. We're seeing more and more health systems get involved in the ASC space. A lot of consolidation of centers under both management companies and ownership, higher acuity and more complex cases being proposed to ASCs. I think everybody's feeling across the board struggles with staffing and staffing shortages and really the higher rising cost of everything across the board, from supplies to talent to acquiring talent. All in the face of reimbursement staying the same. And so what does this mean? It means the most successful and profitable ASCs are the ones that are really looking for ways to automate as many manual processes as possible, looking for every area that they can save, and really using data-driven decisions to really shift their operations from reactive to proactive. So one of the main areas that we've seen is a large increase of profitability for centers that are adopting digital charting. And to simplify that down, we've validated through third-party research that every dollar invested in digital charting through HST ASCs receive anywhere from $3 to $6 in an annual ROI. And the payback period for that is only 2.5 months to cross break even after a software investment. And to break that down even further, there's a number of areas that these centers are seeing an improved ROI from, direct money spent on paper and supplies and storage to a large reduction in time spent chasing down, uncharted information or completing charts, which drastically improves time to bill. So, there's really two main ways that centers are saving. One in terms of time savings and efficiency, and the other is hard dollars on, dollars spent on, paper, stickers, storage. For today, we're going to focus on the time saving features. For anybody interested in more of the kind of the hard dollar saving features, please reach out to us. We can work with you on an ROI calculator that was built for ASCs where we can use your case volume, your costs, your expenditures to build out an ROI report that would show the savings of going digital versus the dollars that are spent and the time spent on paper charting. So one of the biggest areas of efficiency is, for every procedure, you have preference cards that come with, both the physician's orders as well as all the supplies and implants used. When you're using a digital EMR with HST, all of that information is automatically populated. Once a case hits the schedule, that chart is compiled for that specific patient, for that specific procedure, for that specific physician, with all inventory and costs built into the chart without any work from you on the clinical side. All that information is pre-populated and ready right there on the day of service for you to pull up and at your fingertips. Another large time-saving feature is the ability to chart concurrently, meaning that anybody with access to that patient's chart can start inputting information regardless of if somebody else at the center is doing the same thing at the same time. There's no need to ask somebody to sign out. There's no need to, go chase down, somebody's orders. And everything that you do within HST's e-charting is audit logged as well as saved. So any changes made can be accessed, from anybody with access to the chart. Any changes made are documented. If you need to change something back, that's documented as well with a full audit log, but the ability for multiple people to be in updating those charts at the same time. The ability to grab electronic signatures and not have to worry about paper or paper trails, chase down physicians in the parking lot, all the things that go along with hunting down those signatures are very easily done right there on a tablet. If they're patient signatures or a parent signature, if your patient's under 18, everything can be done right there in front of you on the tablet with the touch of a finger. To collect all the signatures you need without additional hardware needed. One of the best benefits of using a digital charting platform is being able to flag incomplete charts or track charts to completion. If you're a Dawn or an admin, everybody comes in the morning and they can see the tasks remaining or any incomplete information and charts that need to be done, brought right up to the top, so that you're able to prioritize, everything needed to get that chart completed and be able to get that over to billing and start collecting for your facility. Another great benefit is the built-in reporting. that's right there, and pre-populated as the charts as you're working through your charts, and collecting and entering any data that's needed, for those cases and patients. Some of the most helpful ones, discharge instructions, being right there and able to be compiled and pulled, directly from the charting software, if and when a patient needs to be discharged, or instructions needed for a transition to another health facility like a hospital, all being right there for you at your fingertips and easy to pull, and not having to go through, stacks of paper, to get those instructions ready, or that information ready. One of the last things, and we talked to clinical staff, especially clinical staff in charge of onboarding new staff or new clinicians, or that work with temporary staff or temporary clinicians. The amount of time it takes for somebody to learn how to chart in HST is very, very minimal. There's a very small learning curve. In fact, most people can pick up the tablet, go right to the area that they're responsible for, and everything's just very intuitive, and there at your fingertips to just scroll, through on that tablet and input the information that's needed for that patient at that time, with very little training or onboarding, needed. We've got a number of kind of qualitative, conversations with directors of nursing that have said, we've trimmed down the onboarding time for new clinical staff from, months to days, to hours. And right now, with the significant staffing shortages that we see in a lot of our customer base, the ability to onboard somebody very quickly, and get them, to be effective within the center and focused on patient care is something that's top of everybody's list. And then last piece here before we actually jump in and look at the demo, we can walk, just about anybody through, the large number of success stories that we see, and especially as they pertain to ROI. But, a key theme that we see is just a dramatic increase in chart completion time, which obviously allows for a significant reduction in AR, and we can walk anybody on this call through some very specific examples. We can provide references of other centers that have gone through this change that can really speak to some of the large benefits in both time savings, staff onboarding, and a large reduction in AR, after a very smooth and painless implementation process, if we take the words of Jimmy Norman here, the administrator from East Alabama Health. So with that, I'm going to stop sharing my screen, and I'll turn the reins over to Chris to jump into the actual platform and do a little bit of show and tell.
Yeah, great. Thanks, Brian. Let me go ahead and share out my screen here, and we'll move right through and just find that share button here in Teams. There it is, or in Zoom today.
And Chris, while you're bringing that up, we do have a couple of questions
Sure.
that I'm able to read here now that I'm not presenting anymore. So one question, is it possible to put a hard stop on the signatures so that the physician can't continue with any charting until the signatures are complete?
Yeah, absolutely. You can set up several different hard stops in the system, right? And one of them is directly around there, right? If we were charting on that patient and we're going into the interop area, OR workflow, and that consent has not been signed yet by the physician. The attestation, H&P attestation, has not been done yet. Those can both be hard stops. There is the ability administratively to overwrite some hard stops if you actually have that stuff done, but maybe it wasn't documented yet. That's totally up to you as the center of how you want to do that. But yeah, definitely the ability to set that up, that certain things have to be done before other charting is done. So.
Yeah, and the last question here, or most current question, does HST EMR interface with Provation Apex, which is used for GI documentation? And the short answer there is yes, we do have some standard interfaces with Provation. Obviously, we'd like to have a deeper conversation to understand what the workflows that you're looking for are. But we have a number of customers that are using both HST charting and Provation Apex with the ability to talk to each other.
All right, awesome. So I've shared out my screen here. I kind of stopped for a second and reshared to make sure I was sharing the correct screen. I believe I am now. You see the login up on that screen, right, Brian?
Yes.
Okay, great. So I'm gonna log into HST eChart here. It is browser based, which is the first thing to notice about it. It is also fully integrated with HST practice management. So one of the first questions people will ask is, hey, if I change that in eChart or in practice management, does it update? Absolutely, right? It's actually in many cases the same fields that you're looking at. So you'll log in. It'll be that same login that you use for practice management as well. So I'll just type mine in here real quick as we're doing that. Actually, hang on one second. Awesome. And you'll be able to go between multiple centers in here if that is your setup too when you log in, if you have access to that. And it'll simply take you right into the e-charting here itself. And no, I don't need to save my password. That would not be a HIPAA compliant thing to do. So I'll kind of change that. When you come in here, this will be set up for your center, right? This is my test database that we're in today. So the layout of the appointment sheet will follow with the layout of your center, mirror exactly what is in practice management today. And we'll talk about kind of how the colors and things look in here. And actually, we'll do that right now. So when we're looking at the schedule in here, it opens up with today's date. I can jump to whatever date I want to go forward and backward in time. What you see in here will be your appointments on the schedule. All these colors in here and icons and different things, they have a meaning. It lets you know what's going on with the patient in the center, where they are. And actually, it'll probably be nice if I just open up a quick little legend here. This would follow the rules at your center, but basically the color of the appointment itself denotes where that patient is in the surgery center. So if you want to break this down by the individual bay, you can as well. And of course, the corresponding colors. The stripe of color here on the right-hand side of the appointment lets you know the anesthesia type. And then the other icons in here are just HST-specific icons. If there are similarly named patients, if there are documents attached that we haven't completed the pre or post-op communications to the patients, if they're filling out their online form through HST, you can have that in there as well. And any notes, right? So just looking at that, you know what's going on with that schedule, those patients, again, where they are. There is a patient locator in here, which you can bring up, have this maybe in the front or the back of the house that will show you where the patients are in the system, how long they've been in that area, who brought them to that area, what clinician is in there, if they're ready for the OR or they're left registration, they're ready for pre-op now, what's going on with those. And there's a front-facing one as well if you wanted to have a public display set up in here where this might be up on a TV monitor in the lobby for family or loved ones they have their patient's number for the day and where they are, and again, what's going on there. And you can have notes pop up there as well. So just some quick kind of settings on how you can set up the patient information in here, or how you might view the chart itself. I will take a step back and I'll echo what Brian was saying earlier about how these cases get created, and they get created based on that preference card for that case, right? So if you're a multi-specialty center, even if you're not, the different charts are going to look different, right? So the chart will be very specific to the procedure you're doing. In fact, if I were to open up my preference cards here on my cases, like Dr. Bennett, for example, for a cataract here, all the items that are used on that case are in here. Now you have this in practice management today, but with eChart, you're able to tell the system where that item is used. Is it a pre-op item, maybe an inter-op or anesthesia item? Does it appear in a specific block of the chart? And then this is how the system knows what that chart would be. In this case, Dr. Bennett, cataract procedure. I'm going to use my ophthalmology chart. This is your domain. These would be the list of the charts you have in your center. And the Dr. Bennett's orders in here, the anesthesia orders, discharge instructions, all customized to that specific doctor and procedure, so that as soon as you schedule the case, this is all created, right? For those using paper charts today, now you get to go in and create all those charts and sticker them. That doesn't happen anymore with eChart. That chart is simply created and ready to go in here. And if I tap on one of my patients to open them up here, for example, I'll go to Marty. He's ready for pre-op. It'll take me into the chart itself and show me what area I most likely work in. It took me into the pre-op area here today because that's what my role is at the center. You can set it to go to any area you want to. The way we've broken down the charts in HST eChart is by what we call workflows. So underneath the menu here for this patient, all the different workflows follow the workflows of a surgery center. So whether it be the pre-op communications area, registration, pre-op itself that I'm in now, inter-op, PACU, the performing physician and the anesthesia provider have their own workflow as well. The reason for this is keeping it simple. Everybody can basically stay in their workflow and move through the areas of the chart that they need to be in and not have to go other places to see that information. And inside each of these workflows, we've broken it down by what we call blocks of information. So here in the pre-op area, patient allergies, height, weight, NPO, room in time, those are all what we call the blocks. We think of them as building blocks in the chart that you can customize. This is how you can customize your chart, because what exists in each workflow and the order they exist are going to be based on how your clinicians work and how they want to see things as they're going through here. We're also tracking you to the percent complete up here and seeing what nothing's completed on this workflow yet on this patient. But if I were to go to another patient in here that I have, and I'll go into another patient here, it'll take me to that workflow and show me what's complete on that patient. Now, I've gone ahead and pre-pinned a lot of my patients to the bottom here. That also makes it easier as I'm going through here. Remember, I'm never locking anybody out of a chart. We have what we call true concurrent charting. And the workflow for Andrea here was fully completed. Everything is in there. Now, are these blocks going to exist in more than one workflow? Absolutely. But the idea is you never have to enter information twice. The allergies, for example, are going to be important for everybody to see, and maybe the patient's NPO status, home meds. So that will all be in there in the area you need to see it. So instead of having to fumble around through the chart as you're moving through to find stuff, it's simply going to be right there. And as you're charting, it's also set up to save you time, where most things are just an easy little click. I can review this patient's allergies in here, what they have going on. I see that at the top. If I'm entering information in here, like the height, weight, this now may have come in from the pre-assessment from the patient, but we'll put in their information in here. It's saving as I go, right? I get my little box, my percent complete is going up. That information's up at the top here for everybody to see as well. No matter where I am in this chart, this blue ribbon will persist for me. So I'll see that information in there. And we're just moving through that chart and moving on there on that particular patient as you're in here. We do have true concurrent charting. So if somebody else was also in this chart and they were charting on Marty here as well, I'd see that information in here as they're doing it. And if they were to change something, I'd see that information change right in front of me. So as we're in here on the patient and flowing through, you can see that happening as we go through that patient in here. And I'm just kind of scrolling through my chart in here. Room in time, it's right now. The patient's walking right next to me. I'm going to go ahead and put them in the pre-op area. And all these drop-down lists and everything else are defined to make it quicker and move through that chart as you're doing it in here. So you can definitely see all that information in there as you're moving through. And again, if somebody has changed something, you'll see that here. This was edited by G Park, one of the users in my system. And I can acknowledge that. And there's an audit log that's going to show you everything that can happen on that patient. So that's kind of that concurrent charting as you move through there on the case as you're in here moving through. All right, so other great features in here to make it quick as you're moving through the chart and doing things. Again, that you can see that percent complete that you're up here. You can pin those patients to the bottom of the chart. You can print out any part of the chart that you want to, or create print sets. The little Q button for quick charting. You can see that that's for basically charting by exception. So if I was charting on this patient in the OR, normally used in there for the most part, but once you do that room in time, you can apply a quick chart, which is like a template for that chart, which will pull in all the kind of non-patient specific information, the staff that's in the room for that day, the equipment that you're using, some of that basic information like positioning and other stuff that is almost always the same on those charts. And then you can just chart by exception. So for those cataract cases and other pain injections and other quick cases, you're not bogged down by charting as you're going through there and bringing that information up in there. So the chart home on a patient will show you the level of completeness of both that current visit summary in here, patient allergies, the vital signs. We do interface with the vitals monitors to bring those right in. Any problems, any external documents that may be attached to that patient can be attached in here. These are coming from Document Central and Practice Management, and you can see that information in there. Maybe it's an EKG strip that was attached to that patient in there. Maybe the H&P from the physician office might be in there as well as you go through on those particular patients. And again, you can go from patient to patient in here as you're looking at those patients and see that information. You will also see, if I go into the kind of chart home here as well, any previous visit information on that patient. So we tend to use the same patients over and over again in our test database. But this patient's been here several times. If I open up one of those old charts, previous visit charts, once that chart is closed, the system will go ahead and create this nice little PDF of that chart. It's also an index PDF, so I could jump right to a specific area and see that information in there, the physician information as well, their orders, or maybe that op report.
Hey, Chris, while you're talking about previous charts, we did have a question in the chat.
Yeah.
How long will HST store those records? And are there things centers are doing for old records in terms of like additional storage needed?
Yeah, a great question. So HST will store those records forever, right? As long as that information is in there, absolutely store them forever. Obviously, if you're still with HST, you can get those out into other electronic file storage if you needed to. I see all my patients in here previously and the visits that are in here because they previously came in when eChart was active, right, for that patient. For return patients, if you've converted to eChart and bring that information in, you can scan those pertinent charts or aspects of the charts into Document Central and be able to store them in there. As the storage grows, because obviously your storage will grow with HST eChart, HST provides you with, I think, a 1 terabyte of storage, and we can expand that as needed. But that we've kind of done on average with charts and documents and stuff attached. It's about 20,000 patients in there, give or take. And so, but if you run into out of storage space, we can add more to that for the centers. There's obviously a cost to storing that information, but it's 100% stored forever as long as the HST is active for you. What Brian was talking about before, when as a user, if you come in here to HST eChart and you go right to your task manager, you can see all the tasks you have open. I have quite a few in my test database because I do these demos and don't really finish everything, but it could take you right to that workflow of that patient if it was completed or not. And when that task got created, it'll take you right to that patient and the area, and you can see what is incomplete. In this case, most of that information is incomplete in there, but easy to, it's the post-op call workflow on Josh, of course. So again, as you're going through here, another nice thing is it's saving as you go, as you put that information in. So if I completed that post-op call, which right now I was doing it, I completed the call, I saved that, the patient information is in there. We updated that information. The questions and everything are fully customizable for what you ask. So they don't have the temperature in here. No, everything is good, right? And you'll see if something was missing, it would let you know what you forgot and what you needed to put in. So it's tracking you to that completeness as well until you're complete. It'll let you know it's incomplete, but it did save what I did in there, and I don't have to move on from that as well. All right, we talked about a lot of that information in here. I did want to go back here. One last thing, I was talking about concurrent charting and the There we go. The patient information in there and those audit logs. When I was in Marty, for example, we saw that live edit. The audit log will always show you exactly who changed things in here and what time they did it and what they changed it from and to. So what I put in earlier and what G Park came back in and changed, old value and new value, what was updated. Every time it's updated, you'll see that information in there. So I know we're reaching about the bottom of the hour. We kind of hit on some of the highlights of HST eChart. Can't stress enough how it is customizable for what you see in here and how you're working through it, that you will have the ability to do that concurrent charting, always seeing everything up there for you. Updated, it does a med allergy check for anything counterindicated. Quickly, one of the reasons that physicians actually don't mind, I should say. I was going to say do like using eChart. They're never going to like using any kind of electronic documentation, but they don't mind it in HST because as a physician, when I log in and I click on a patient, it'll take me right to that workflow for that patient. And typically there's only a handful of areas the physician has to deal with, much less in here. So they can do a lot of this from anywhere because they can access this from anywhere. It's browser based. And as they're going through and clicking on things, the H&P attestation, for example, they've signed off on this one. The physician orders, it's literally one click to select all their orders, and they can sign off on that as well, just by signing it in here or using the information on there. So a couple clicks, there's actually only 4 places physicians need to sign. And again, their workflow is going to be tracked to its completion as well. But I'll pause there because I know we're a couple minutes over and we wanted to have some time to answer some questions. Brian was monitoring that chat. So I will pause and see if there are other questions out there, or we can start to wrap things up.
Yeah, Chris, nice job. We had a couple that I answered in the chat that were very specific to examples of facilities, ortho facilities that have transitioned to digital charting. So I shared a case study that we published, and we definitely have a number of referenceable customers that are very ortho specific, and some that are even open to some site visits. So I'd recommend for kind of more specific ortho examples, you can get in touch with your HST rep. We can do an ortho specific demo, as well as provide both documentation as well as references to better understand that change management involved from going to paper to digital in an ortho facility, or any of the other specialties that are on the call as well. We can provide very specific specialty specific information on those transitions, as well as put you in touch with some peers that have made those transitions in the past. It looks like one more question, Chris. We have an extended recovery unit with overnight capabilities. What would that be? Would that be customizable or a different phase of care?
Yeah, definitely customizable. It could be a different workflow in there as well. So you might have the traditional PACU or post-op workflow, and then a additional separate extended care area. So, and again, all those the kind of the blocks that you see in there today, we have about 150 internal ones that we created with HST that most people might use, that height, weight, and home medications and things like that. But you can fully create and customize your own blocks for that, questionnaires and how you're tracking things, patient handoff, all the other stuff. So yeah, I didn't have one today in my test environment demo, but you can definitely create a workflow for that.
Thank you, Chris. I'm not seeing any more questions coming in. Maybe a couple more seconds to ask questions. Otherwise, we can wrap this up. Again, we will send the recording out to anyone that registered for this webinar this afternoon. And please, if you've got some deeper dive questions or want some deeper dive examples, we can absolutely provide those for you. Actually, one more question came in, Chris. The biggest challenge is convincing providers to switch to an
Yeah.
EMR system from paper charting in the ASC setting. What do you do to navigate this challenge? Yeah, great question. And typically we see the objections, mostly being around change management, right? There's some in terms of the investment, which we definitely have some tools that we can help you recognize very specific ROI to your center. The other thing we can do, Chris is he's got a number of variations of this demonstration. We've got very physician specific, areas, so they can be hyper focused on what changes they'll have to make. We can have kind of demonstrations very specific to the workflows of the clinical staff as well as the administrative staff. I think all this would kind of start with just a discussion around where are some of the biggest barriers, or where most of the pushback is coming from the providers. And more often than not, there's some conversations that we can have to help you overcome those conversations. And really, I mean, change is hard sometimes, right? And we can walk you through some very specific examples and be very prescriptive in terms of what the implementation will look like, and what training will look like, and then kind of what good will look like at the end of the implementation and switch. One last question here, Chris. Once a surgeon signs is their signature saved, and they just click sign? So kind of talking about over the shoulder signing there, Chris.
Yeah, exactly. So what we can do in that case is, yeah, everybody, when you're like, as a nurse, you're signing as a witness of the consent, the patient can sign right on the tablet with their finger or stylus. A physician could, because they're logged in, they actually don't need to do anything like they click the button that says sign, and it's an e-signature. It's validated by their login. If you are having a physician sign like the consent with you and the patient, you're the nurse in that scenario, they can do that over the shoulder sign where they could either do it with their stylus or finger where they're signing on the tablet, or they could just quickly type in their credentials and do an e-signature on that. So it doesn't log the person out. They don't need to log in separately on a separate device and find that patient and go navigate to the spot at all. It's very, very simple for them. So yeah, it doesn't make them do extra work on that. And that's one of the reasons, like I said, we do get pretty decent buy-in that I think you will get from an EMR for the providers, because it is very, very departmentalized or compartmentalized for them. When they log in, they go right to their area. Everything they need is in that one area. It's just simply scrolling through. They don't have to go anywhere else to see any information. So it's very, very simple for them. They're probably equating it to Epic at the hospital, or maybe their practice system where there's many, many areas for them to go into. We keep it simple. If there's, 5 areas they need to be in, that's all 5. So.
Awesome. Thank you, Chris. There was additional question. I typed out the answer. Somebody asking for ortho ASCs in California. I'll reach out after the webinar here, and we can get that process kicked off for you for sure.
Absolutely.
Well, thank you everybody for the great questions. I really hope this was helpful, a good use of time on a Friday afternoon, and look for more demos like this in this series. We're really excited about this and appreciate everybody's engagement and attendance.
Great. Thanks all.